Hello, my name is Alfonso Hernandez, and today we're going to be talking about the need for medical interpreters. The objective of this presentation is to make it clear why we need medical professionals, why family interpreters are not reliable, and how organizations could go about implementing professional interpreter services in their facilities. The need for interpreters. There are many patients in the United States who do not speak English and who do not grasp the concept of English medical terminology when being explained the medical disease process. They're more likely to misunderstand discharge instructions, miss medication, and get readmitted. Around 25 million people in the US have limited English proficiency, not to mention the limited health literacy. Hospitals frequently rely on family or bilingual staff who lack interpretive training. Professional interpreters, on the other hand, reduce errors and improve statistics. My pickle prompt is, in patients with limited English proficiency, how does the use of professional medical interpreters compared to the use of ad hoc interpreters, such as family or untrained staff, affect patient outcomes like satisfaction, adherence, and readmission rates? Family-based interpreters and literature review. While family members mean well, their lack of training limits their effectiveness. Spearoff echoed this concern, stating that emotions and family bias often lead to incomplete or inaccurate translations. This could also mean that they might try to soften the news of whatever is going on with the patient and lead to a misaccurate representation of what the disease entails. Another study shows how family interpreters may omit or distort sensitive information due to cultural taboos or embarrassment. While family may provide comfort to some patients to have them nearby and be a support pillar, their interpretations could lead to errors occurring. Professional interpreters and literature review. Professionals have a code of conduct that they have to follow while they're providing their services. An expert will know how to translate treatment, detailed medical questions, and diagnose accurately. There are languages that are less common but just as important, such as Somali, Sign Language, and Cambodian. One of the many barriers found to why these services were not being widely used was the amount of time they can take up to set up and use, and the amount of people who have the medical proficiency to interpret doctor information. Implementation. The hospital will need to secure a temporary contract with reputable interpreting services, either on site, over video, or a phone. A nursing manager as director in place, they will be able to host in-services to train staff on using the interpreter system, be it using a tablet or in person, and dedicated interpreters. There will be provided bilingual signage, posters, and how-to guides, which can help both the staff and clients be able to get these services. An emphasis on preferred language can be added to the patient's chart, and if they want to use the system as a waiver, since it is still having to do with sensitive client information. As the rollout starts, client satisfaction surveys will be distributed to the clients who use the services as well as those who do not and are willing to fill out the survey. A 3-month pilot program will be implemented as results can take time to really show. The things to watch out for while implementing this new system will be resistance to change, limited staff time, and budget constraints. Many factors will come into play when evaluating period starts. Patient satisfaction can be viewed in their survey reviews and patient readmittance if it was related to a previous visit. Compare pre and post intervention data for patients who do not speak English as a first language or have limited proficiency. Medication adherence can be studied with follow-up pharmacy refill data. Are the clients taking the medication and how often they need to get refills? In the end, it will come down to collecting baseline data for 3 months before the pilot, collecting survey data during and after the pilot, analyzing the data using simple comparison charts and satisfaction scores to see how well the implementation of this bilingual service would take. Dissemination. The dissemination of the study will be done in multiple steps. Present findings to hospital leadership and the medical board, submitting an abstract for a poster session at a regional or national nursing conference. With a good backing and interest for certification, the results will be shared and presented to the Texas Board of Nursing for continuing education credit. My expert for this presentation was Susan L. Hamilton. She is a professor at Sarang County College, and she is the program coordinator for a cohort of students called Éxitos Juntos, where they teach students to be proficient in medical terminology in Spanish in order to graduate nursing school with a certification for interpretive services. Susan Hamilton is a bilingual nurse practitioner and educator for 10 years of experience in pediatric nursing. She currently serves as a coordinator for Éxitos Juntos. Her extensive work in cultural competence care and her outreach to Spanish-speaking communities make her a highly qualified expert in the area of language barriers in healthcare. Ms. Hamilton has had first-hand experience in how communication gaps affect patient care and outcomes, especially among pediatric and Hispanic populations. During the interview, I plan to explore Ms. Hamilton's insight into how language barriers impact healthcare delivery and what strategies have been most effective in overcoming these challenges. The interview will strongly support the capstone topic, implementing language barrier resolutions and the effect of patient healthcare outcomes. By providing real-world evidence and successful interventions and highlight ongoing needs within bilingual populations, Ms. Hamilton's unique perspective will help strengthen the practical recommendations in my capstone paper and presentation. Summary. Language barriers shouldn't prevent patients from receiving quality care. This project shows how professional medical interpretation improves satisfaction, reduce errors, and prevent readmissions. Implementing interpreter services across hospital units can promote safer, more effective communication. With the right tools and policies, nurses can deliver care that every patient understands.